Welcome to the second part of our video on managing existing PICC lines. Let's explore the essential steps for EMS providers. This video outlines the 7-step process for safely accessing an existing PICC line in the field. Always follow your agency protocols and medical direction. Step 1 is to confirm the clinical need. Ask yourself if vascular access is truly required or if other options like a peripheral IV or IO are more appropriate. Step 2 is to confirm the line. Locate the insertion site, trace the catheter to the hub, and verify its identity. Do not use the line if you cannot confirm it is a PICC. Step 3 is inspection. Check that the dressing is intact and the site is free of issues like redness or swelling. Ensure the catheter is undamaged. Step 4 involves setting up your workspace. Place your supplies within reach, confirm your medication orders, and keep the catheter hub visible and protected. Step 5 is to disinfect the hub. Use approved antiseptic with firm friction and allow it to air dry. Maintain a no-touch technique throughout this step. Step 6 is to confirm patency. Never force a flush. If you encounter resistance, leaking, or pain, stop immediately and use an alternate access site. Step 7 is to administer your medication or fluid. Ensure you have the correct dose and rate, monitor the patient closely, and be ready to stop if any problems arise. Step 8 is monitoring. Keep a close watch on the patient's vital signs and the condition of the line, especially after any movement or patient transfer. Finally, Step 9 covers securing the line and handing off to the receiving team. Document all findings and communicate clearly about what was administered. When administering medications, remember that the PICC line does not change your scope of practice. All medications must follow established ALS protocols. Be mindful of compatibility. Do not mix unknown medications or fluids, and always identify what is already running before adding anything new to the line. Certain high-risk medications require an electronic infusion pump. During interfacility transports, ensure your equipment is authorized and fully functional. Be aware of high-risk medication categories, such as vasoactive drugs or concentrated solutions. Use caution and follow all local guidelines for safe transport. When performing interfacility transports, verify all sending orders and labels, confirm your pump settings, and document the entire handoff process clearly. Regarding safety, never force a flush. Avoid using damaged or infected lines, and never leave a central line open to air. Documentation is essential, even if the line was already present. Be aware of common complications such as occlusions, infiltration, suspected infections, or catheter migration. Always assess the line before attempting to access it. If you encounter occlusion or resistance, stop immediately. Do not attempt to force a flush or use thrombolytic agents unless a specific approved protocol exists. If you suspect infiltration or extravasation, stop the infusion immediately. Do not continue to push medication. Switch to an alternate route and document your findings. For a suspected line infection, avoid using the device unless directed by medical command in a true emergency. Use alternate access whenever possible. If you identify an air embolism risk or a damaged line, secure it safely, support the patient's ABCs, and contact medical command for guidance. Should you notice signs of dislodgement, do not use the line. Do not attempt to push it back in or repair the catheter. Document the finding. Follow this simple troubleshooting rule. If it doesn't look right, doesn't flush normally, or if the patient reports pain, do not use the line. Accurate documentation is a critical safety practice. Record the reason for use, line details, site assessments, and any medical command orders received. Use a standard checklist for your patient care report to ensure you capture all necessary data points regarding PICC line access and monitoring. Here is some sample wording for your documentation. Ensure your report reflects the specific findings and actions taken during your patient care. Always communicate the use of a PICC line during your handoff to the receiving facility staff, including any concerns or issues you observed. In a scenario involving a septic patient, remember to prioritize the assessment of the line's integrity before considering it for emergency access. When faced with a suspected infected PICC, do not use it unless directed by medical command. Focus on alternate access and proper documentation. Let's discuss a scenario involving a patient in cardiac arrest with a visible PICC line. The dressing is loose, and no one is available to confirm its status. In this scenario, we consider an interfacility transport with a medication infusion running via a PICC. You must verify orders, the pump, and the line status. Consider a case where a family asks for help with PICC care teaching. EMS can reinforce general safety, but should refer specific tasks to the care team. Moving to our Skills Lab overview, we will cover device identification, workspace setup, patency simulation, complication recognition, and documentation practice. Station 1 focuses on device identification. Learners will locate the site, distinguish a PICC from other lines, and recall that if they cannot confirm it, they should not use it. Station 2 covers assessment before access. Participants must check for red flags like redness, swelling, or damage to the catheter, and decide if the line is safe to use. Station 3 addresses setup and hub disinfection. This is crucial for infection control. Use the correct technique and maintain a strictly no-touch environment. Station 4 is about patency and simulation. Verify your orders, check for patency without using force, and be ready to stop if any issues or resistance arise. Station 5 focuses on complications and handoff. Learn to recognize occlusions or dislodgement, contact medical command when needed, and provide a clear report to the receiving staff. The Instructor Evaluation Guide helps ensure competency. We verify that providers know their scope, perform proper hygiene, and document their actions accurately. We also address common mistakes, such as using a line without an indication, failing to inspect the site, or forgetting proper disinfection techniques. Final takeaways: only use confirmed lines for indicated reasons, maintain strict aseptic technique, never force a flush, and ensure thorough documentation. Thank you for participating in this session on PICC line access and safety. Please reach out if you have further questions or need clarification. For instructors, please consult these official references, including Pennsylvania Scope of Practice and local protocols, before finalizing your training materials. This slide provides detailed citations used for our training, ranging from state clinical resources to CDC infection control guidelines. Ensure your local policy aligns with these standards.